Hi, it's Sadman, and previously, in my previous video, I said that I'd talk about my surgery, the surgery I had for a condition. Well, the title says it all. It's anal fissures, things that happen in the anus. Well, sorry, I look kind of horrible because it's been a hectic day. I'll still go with the video. Well, basically, what anal fissures are, people sometimes confuse it with hemorrhoids, but in reality, it's something totally different. Even though both origins from the same reasons, which is constipation. In most cases, for both men and women, but women are more prone to that, and especially women have anal fissures uh, after they gave birth to children. Okay, so what fissures are actually a tear in the anal canal, where it's near the a-hole. So, in simple words, a-hole and a-hole with fissures. Okay, so it's basically the Joker face from the Batman Dark Knight, only in the anus, and much more painful, I guess, because the hard stools, make it make it hard. So basically, what happens during anal fissures is obviously for the tear you feel the pain, and the tear is pretty much hard to recover from um, due to the continuous bowel movement, and also it gets even worse if your stool is pretty much hard and lacks fiber. So it bleeds and hurts a lot, and you get scared for sitting for a stool or a bowel movement due to the trauma you face and the pain. So this in turn actually uh, curdles the biles inside you, and it gets hardened and turns into constipation. So it turns into an endless process. So there are certain degrees of anal fissures, from acute to chronic. So acute fissures usually heal by themselves if you just maintain a healthy diet and a lifestyle. Usually within 6 weeks. Well, the chronic ones, they need special attention, and most cases they need surgery. So it's a risk-free surgery, and also the success rate is somewhere near 100%. There are some complicated cases, but they're pretty much rare. It's less than 1%. So. Well, I had my surgery in the 23rd December last year, which is 2015. So, uh, well, the surgery lasted for about 20 minutes. The surgery was called lateral internal sphincterotomy. They make an incision in my sphincter, the muscles, engaged in moving your bowels. So I didn't actually feel any pain when they did the surgery, even after the surgery. But the first time I went for a poop, that hurted a lot because, well, the wound was closed, so it was tight due to the traumas faced in the surgery. So the stretching was a bit painful. Yeah, I'd say it was a bit painful because, well, it was still far less compared to what I had to face before the surgery. Well, and I kind of had the main problem is it's the bowel incontinence. I had trouble pooping. I guess it would be it's normal because I had surgery there. So finally, I still blood still came out with my poop on small amounts, and it was somewhat painful. And I always had to wear a dressing because there were liquid discharges, be it mucus or uh, blood. But then finally, yesterday, in January 5, I actually had my first normal poop after 6 long months. without any lubrication, without any preparations. So it took about 2 weeks to completely heal. And about the surgery, well, I the surgery started at 5 p.m. in December 23rd, and it took about 20 minutes. And after that, they kept me at ICU for 5 hours just to see if I so that I get immediate attention if by any circumstance I go through pain or something. But fortunately, which didn't happen. I didn't need any other certain attentions from medications. But and the next day at 10 p.m. Then 10 a.m. they gave me my release paper, so I was good to go home. So the medications post surgery were antibiotics and painkillers for first 5 days, and a relaxing ointment and an antiseptic, which I was to apply after every healthy bowel movement, which they estimated around 2 times a day, which didn't happen actually. I only pooped around once a day. Not a good idea though. So yeah, it was a bit troubling. I had discharges every now and then, but thanks to my man pads I made myself, I cut myself the discomforts. Well, I'm still normal as concerned to bowel movement, though I still have a little mucosa discharges from my anus. Although, well, I check my curtains frequently, so the curtains are applied. No, that's not fetish, so stop judging me. Well, it only has mucus in it. It doesn't have any traces of blood anymore. The operation took well, the whole operation thing and my stay over at the hospital costed around 22,000 taka, which um, translates into $295. So as you can see, it's pretty cheap, and well, it was done pretty well. Living my normal life. I can soon go ahead with my martial arts career. Yes, I'm a martial artist. I'm in the national Thai boxing team, and I'll be able to start from February. Well, I can start even now, but I just don't want to take the risk. So so yeah, and as I said, it's a common thing, and the reason I made this video is because I don't actually see any people giving reviews, video reviews after having the surgery, but they have a lot of things as to why anal fissures happen, what you should do, but what you people should do after surgery, it's not even provided here. So yeah, that's the thing. Okay, so if you have any questions regarding my condition, please feel free to ask. Bye.